In this video, we are going to discuss the anatomy of respiratory tract. The respiratory tract can be divided into three parts: the upper airway, the conducting airway, and the alveolar airway. The upper airway includes nose, nasal cavity, mouth, larynx, and pharynx. It has two major functions. The first is humidification and warming of the airway that we breathe, ensuring that we do not lose a lot of heat while breathing. A second is to filter out large particles from the air we breathe. Particles larger than 30 to 50 micrometers are filtered out by the nasal passage. Smaller particles between 5 to 10 micrometers get impacted into the back of pharynx. The conducting airways start at trachea and branch into bronchi, bronchioles, and terminal bronchioles. The pattern of branching is dichotomous, meaning every single passage splits into two smaller branches. The conducting zone consists of 16 generations of these branches. Trachea and bronchi are lined by pseudostratified ciliated epithelium. They contain goblet cells and acinar glands which together form the airway mucosa. They are wrapped by a layer of smooth muscle which is held open by rigid plates of fibrocartilage. Bronchioles and terminal bronchioles are narrower than bronchi. The secretory glands and cartilage begin to disappear here, and smooth muscles become the dominant layer. Towards the distal end of conducting airways, epithelium transitions to non-ciliated cuboidal cells. These secrete defense markers and also act as stem cells to repair damaged airway epithelium. The alveolar airway includes the final 7 generations of airway division. These include respiratory bronchioles, alveolar ducts, and alveolar sacs. This amount of branching increases the cross-sectional area of airways exponentially and creates a large area of around 70 square meters available for gas exchange. Now let's apply this knowledge clinically. The conducting airways are lined by cilia. A sticky layer of mucus rests on top of these cilia. Cilia beat at a frequency of 10 to 15 Hz and pump the mucus upwards. This two-layer system traps foreign particles and pumps it away from the lungs. When ciliated cells are damaged, such as by cigarette smoke, toxic gases, or genetic mutations, mucus transport stops, causing chronic sinusitis, lung infections, and bronchiectasis. Cystic fibrosis is an autosomal recessive disorder caused by mutation of cystic fibrosis transmembrane conductance regulator gene on chromosome 7. CFTR is a chloride ion channel found in secretory and absorptive epithelial cells. In healthy lung, CFTR maintains sodium and water balance outside cells. Patients with cystic fibrosis make abnormally swarty sweat, but in lung tissues, opposite happens. Sodium moves from airway lumen into tissue, pulling water with it and causing drying out of secretions, thus paralyzing the mucociliary mechanism. This leads to chronic pulmonary infections, progressive tissue destruction, and eventually respiratory failure. This is all about respiratory tract anatomy. If you liked the video, subscribe to my channel and I will see you in the next one.